Where exactly is Nigeria in terms of how the country has thus far handled COVID-19? Are the numbers up or down? Is there a reason for us to still be afraid, or we're in a good place? Recently, there's been a lot of talk about the country getting close to a flattening of the curve. But such discussion has quickly also been extinguished by sobering developments regarding the pandemic, especially in the country's hotspots and largest commercial center, also Lagos. Was it a case of being overly optimistic? Has there been a definite pattern of reflecting testing numbers, or more succinctly put, how much improvement has been made regarding testing? And what about the easing of the lockdown and the general resignation, it seems, on the part of the general public towards observing the safety protocols? A lot to talk about, really. And for all of that, we're now being joined by one of Nigeria's most renowned virologists, Professor Oyewale Tomori, a professor of virology and a former vice chancellor of Redeemers University. Good morning, Prof, and thank you for joining us on the morning show. Good morning.
Good morning, my friend. How are you doing today?
I'm fine, sir. Good to see you, sir. Well, quickly,
My pleasure.
Where are we with this war against COVID-19 in Nigeria? I know you are the head of the body of scientists advising the presidential task force. What have you been able to achieve so far? Where are the areas of omission? What is the way forward in terms of ensuring that we get the balance between revitalizing, reopening the economy, and ensuring that Nigerians keep safe?
A lot of questions, but let me start from, are we flattening the curve? We're not. Apparently, I think what we're doing is we're flattening the truth. And that's where the problem we have in this country. You remember the PTF came up and said that during the Salah holidays, there were no testing. We noticed that a long time ago. A week before the Salah holidays, Nigeria tested about 11 samples. During the Salah holiday period, we tested half of that. But what was more worrying was the fact that the number of positivity rate was even higher, after during the Salah than before the Salah, which means we're not making any progress as much as we should. The numbers are rising. And I think what is even more worrying for me is the fact that the attitude of people to the disease is like, we lock down, we ease the lockdown, the numbers, whether we lock down or we didn't lock down, the numbers will kept going up. I think that's where the problem is. The solution to this is with the people. It's not with the government. It is me and you who will get COVID. The government will not get COVID. The government will not die from COVID. It is that individual person that will die from COVID. Therefore, you are the most important in this COVID problem. And until we accept it that we are the most important player in this COVID thing, we will not see the end of what we are getting.
Well, Professor, the government has again extended the phase 2 of the easing of the lockdown. And from what we are seeing, almost 320,000 tests have been carried out. 46,000 of them have been confirmed positive. And unfortunately, we've recorded 945 deaths. In your professional opinion, do you think that we should remain on this easing of the lockdown, or do we reverse to a total lockdown? I'd also talk about precision lockdown for those local government areas that have, this prevalence of the virus. Should that be the way forward?
Most important thing, I think, lockdown or no lockdown, if we do not play our role, the lockdown or easing of lockdown will not make any difference. And that's the point I've been trying to make, that yes, the lockdown could help, but what will help mostly is me, what I do personally, in washing my hand, in keeping that distance, in wearing my face masks everywhere we go. Those are the things that will make a difference. You talked about targeted lockdown in certain places where we have a major problem. But the problem is that the data we have does not even help us to know where we have the problem. For example, if you go to the NCDC website, they will tell you that 2% of the cases we have in Nigeria came in from outside. They were travelers. About 20% of them were the people who had contact with those who traveled. A whopping 75%, we don't have a clue where they got the infection from. So something is wrong somewhere there. If you don't know where they got the infection from, if you don't know who is giving the infection, how are you going to do contact tracing? How are you going to know where the problem is? So we need to do better than we are doing in terms of the data that we're getting. We need to be able to pinpoint who is giving the infection, where is the person giving the infection. Take the issue when you take your blood, your sample, and you use it and you wait for 7-8 days before you get your result, and you then end up as being positive. Can you remember where you have been the last 7 days? So these are all factors that play together. Lab result must come out as quickly as possible so that we know those who are sick, who are positive, and put them in isolation as quickly as possible. If you have to wait for 5, 6, 7, 8 days, I don't know where I've been in the last 5, 6, 7 days. I don't know whom I've contacted. So there are certain basic issues we need to do. And concerning the testing we're doing. An example, if you give 500 samples that are positive today, were they collected today? Were they collected yesterday? Were they collected 2 days ago? Were they collected 4 days ago? So what we're getting is not an epic curve. We're getting laboratory result curve, which means we are behind the epidemic. This is have occurred like 3-4 days ago that you're not saying, oh, the thing is occurring today. So we're running after the epidemic. And until we sort out ourselves in relation to all these better data in this country, we will never get to the end of the problem.
So my questions, I've got 2 questions. The first one will be, if we're behind the epidemic, a lot of people will attribute that to the kind of testing, molecular testing we use. Isn't it the time to look at other forms of testing, even if they're talking about false positive or false negative? Secondly, you talked about the people taking responsibility. This is where the question comes as regards force. Is it not time to use probably some level of force? Because if you leave people to take responsibility, goodness me, they will not take it. I see people moving all around. They don't even wear face masks again. We don't even have police enforcing the wearing of face masks again. Sir, it looks as though to me Nigerians have forgotten that COVID-19 still exists. They think it's over.
My friend, you are saying the things that we've been saying for a long time. Let me talk first of all about the tests that we're doing. Yes, there are problems with the tests. There are not enough laboratories in the country, but that's because we did not prepare as a country. There are laboratories, about 400 of them, that have been in existence for other diseases, which could have been repurposed for what we're doing now. But rather, we started building new laboratories. I think we have about 60 of them now. Yet there are about 300 or 400, which have been there before. But let's even forget about that one. There's also the issue of getting the kids and all that kind of thing and all this. Whatever we're getting now is the effect of the years of neglect that Nigeria has had about anything science, about anything health, about anything laboratory. For 60 years, we have neglected all those things. And now we are paying the repercussion for all those errors of the past. So that's one of our tests. Of course, you can use the RTD test, but many of them are not validated. Many of them have major problems. Therefore, you may even be compounding the problem by using those ones. Because if somebody who is false positive, if you say it's positive and it's not positive, or you say it's false, it's negative, you say it's positive and the man is negative, then you're creating more problems for us. Now, on the other issue of public involvement, should we use force or should we? I think it's a matter of persuasion. It's a matter of getting the right message to the people. It is your life that you're playing with. Talking about law and enforcement in Nigeria, forget about those ones. There's a lot. Okay, see, the problem with the issue of forcing things in Nigeria, laws are meant to be broken in Nigeria. Laws are meant to be bent. So when you put any law, forget it. The policeman will collect bribe and we don't force anything on anybody. I think we need to appeal to the individual, to me and you, and say, look, your life, you are playing with your life. Nigerians love life. Let's use on that approach to see, protect your life. And that was the error I think the government made from the beginning by assuming that they are the ones that are controlling this thing. It's not the government that is controlling it. It is the people that are controlling it. What we do, what we don't do, determines what disease we get. Therefore, I think we should go in the press and everybody, the media. Let's talk about persuasion. Let people know, and then draw the attention to the people that it is your life you are playing with. I keep saying the government will not die from COVID. It is me or you that will die from COVID. So put that emphasis on the individual. Make him the important person, the important role player. Of course, we have a problem with discipline in Nigeria, but I think when it comes to the issue of our life, people know how to take care of themselves. They don't want to die. So these are the issues. Let's persuade. Let's get the right message out to the people that they are the more important people in this COVID control. That COVID is there and it's killing people. I feel so sad to see people dying.
Prof, you are the chair of the expert review committee on COVID-19. As I indicated earlier when we started this conversation, I would like to know, and I'm sure some of our viewers will also be interested, what level of support are you getting from the Presidential Task Force and from the federal government? Because I see you've been very forthright about where government dropped the ball and how the people are also not taking responsibility. And is our intervention at the level of policy and engagement, is it driven by data? Because we've seen in other countries, once they take a policy step and there are issues, they step back. We've seen that in Israel, we've seen that in South Korea. But here in Nigeria, it just looks like we're just experimenting. Is the federal government even listening to your committee at all?
Let me put it this way. First of all, we're at the minister, not the PTF.
Okay.
So I think is to the minister, and we've provided appropriate recommendations. We looked at the data. Although we could get better support in terms of data, from the NCDC, which we are not getting right now. We could get better support. I talked with the CEO of NCDC, and he tells me some of the problems they too are having with getting data, even from the states. My friend, we're in an emergency. This is not the time for states to start claiming right over something. In an emergency, in a war situation, there's a commander, and that's the president of the country. There's a PTF which has settled. We should all work together with that PTF. Make sure that, whatever it is. But the PTF itself must be driven, his action must be driven by data. And that means that everybody concerned with this, NCDC, and all the other people, will work together. We are different arms or different fingers of the same octopus. And we need to work together. Bring on all the facts and coming out. States should not be hiding data. States should not be hoarding data. Why? It's not the state that has it. It's the whole Nigeria. We're in a pandemic situation, we're in an emergency situation. The states cannot begin to talk now about the fact that health is on concurrent list. I don't want to say it's stupid, but it's something very close to it. Because what is happening in your state is affecting other states. And when we have a president who has put down a PTF, we should all work together on that one. All states should work together. Maybe one of the errors we made in the first place was that before the PTF was set up, I think the president should have called together all the states and said, look, we have an emergency in our hands. I don't know whether he did it, but apparently it doesn't seem like he did it. If he did it, it means they're not listening to him. We should have called all the states together. This is a national emergency. Let us all work together. The PTF is there to coordinate this one. But right now, it's that every state is doing what they like. Everybody is going around different. See Kogi, for example. See Cross River. When now the chicken is coming home to roost in Cross River. They denied for a long time. They didn't have anything. See what is happening in Cross River. Kogi is still denying. And yet, this is a country. What type of country are we? Where, for the sake of the people, we don't have a proper control for anything. We are in an emergency, my friend, and we must behave as we were in emergency. What the PTF is doing, they need support, they need the backing, and every arm of the government, whether the NCDC or we must pool our resources together. Today, when we're looking for data about Nigeria, we don't go to NCDC site. We go to Johns Hopkins. Where did they get the information from? We go to our world in data to get the fact details because somehow whatever it is they get, they make use of it. So if they can get all those things, why can't we in Nigeria get all those other issues? Why are we putting this thing together? And I keep saying each of the different branches we have, we are different arms of the same body. You cannot have the left hand cannot say I'm going to wash my hand alone. We need both.
Well said, Prof. You said we are running behind the pandemic. But tell us, how important is it to get test results quickly? How important is that to this war that we're fighting? That's one, Prof. Secondly, you put so much emphasis on the people. Why do you think that the people are so nonchalant and they are not buying into this message? They're not keen into this message by the authorities. Is it a problem of lack of trust or honesty? What's the problem here?
Let me start with the test. The good thing about the test is that the earlier you get out your result, the earlier you know who is positive, the earlier you can isolate the person, the earlier you can prevent him from spreading the disease. That's how important it is to have test result on time. I alluded to the fact that if I have to wait for 10 days before I get my result, and then you now tell me I'm positive, what happens in the last 10 days? Where have I been? I've been to different people. I've touched different places. I don't know whom I've come with. I've sneezed into the face of one or two other people. I don't know. So the earlier I get the result, then the better we are. That's why I say we are behind the epidemic. But if I know now that I get it, then you put me in isolation, then of course that means that I'm not in a position to spread it to other people. And when in your record you show 75% of the people that are positive, you don't know where they got the infection from. What are we talking about? What are we talking about? These are the issues. Back to the issue of trust. We've never had a government that we trusted in this country, have we? They've lied to us day in, day out. They lied to us when they're campaigning. They tell more lies when they're in government. I used to say that we're unlucky in this country to have two parties who are Siamese twins, APC, PDP. Unfortunately, they have only one brain. The two of them are Siamese twins. Then, unfortunately, the brain goes to the one in opposition. When they go into government, they have no brain to discuss with us. These are the problems we're having. We never trusted our government. They've never trusted us. And that's the reason. So when they're giving us data, even when they're telling the truth, we won't take it because they have always lied to us, for all the right. Go back to history. Which government has told you the truth about anything? So why should we believe them when it comes to COVID? But then, of COVID. But I think for the sake of the people, on this occasion, please accept that this problem, even if they are not, take the precaution you need to take. Because if you don't, and the COVID catches you, then it's either you survive or you die. Okay. So if you don't trust the person, it doesn't matter. But believe that at least you've seen what is happening in other parts of the world. So please, I'm appealing to our people, believe what is going on. Take care of yourself. Wash your hands. And as well, let's persuade the people. Let them realize the importance of what they are doing. Let them know that if they don't do it, they will die. And I keep saying, this government will not die. It is you, it is me. And if you are the only breadwinner in your family, you can imagine what that means.